And I am, as introduced by our dear Dr. Sonia, that I am Dr. Arif, a medical oncologist from Core General Hospital, and my topic of presentation is real-world outcome of immunotherapy biosimilar in solid and hematological malignancy retrospective analysis from Bangladesh. Now, background of the study. Cancer disproportionately impacts the quality of life and lives of lower and middle income countries. As the cancer treatment and diagnosis success increase in the higher income countries, the impact of cancer-related death is expected to be around 75% in lower and middle income countries like Sub-Saharan Africa or ours. In this context, immune checkpoint inhibitor like Pembro and Nivo have transformed cancer treatment, offering durable response and improved survival. Now, when considering the cost of the treatment, when we are seeing the graph of the US of 2024, 73% of the cost has been covered by the insurance. When considering the cost in our country, around 88% of the cost from the out-of-the-pocket expenditure. So, considering the annual treatment cost range from USD $150,000 to $200,000, there's quite a big ask for people like us. In Bangladesh, we have around 173 million people, and we have facing some difficulties like developing healthcare infrastructure, established specialist centers are lacking, and we have less access to advanced cancer therapies like immunotherapy and others, and there is high cost of originator biologics, lack of comprehensive health insurance coverage, significant out-of-pocket expenditure, as I have mentioned earlier, and limited availability of advanced treatments. My study objective were to evaluate the real-world outcome, to analyze the effectiveness and safety of the immunotherapy biosimilars, Pembro and Nivo, in patients in solid and hematological malignancy in Bangladesh, and to compare the treatment options as a comparative efficacy between the Pembro and Nivo arm, and to identify the specific factors which can impact the outcome of the response of these patients, and to support evidence-based policy to transform into the clinical practice and to the healthcare decision-making in Bangladesh. These are the methods. This was a retrospective analysis done in Core General Hospital from 2022 to 2024. Most of the patients are adult, more than 18 years. Solid and hematological malignancy has been selected and received Pembro or Nivo biosimilar and included regardless of the cancer type, prior treatment, and performance status. Our study population, we have 160 patients. Between them, 87 patients received Pembro and 73 patients received Nivo. The mean age is 56.5 plus minus 14.8 years. Male patients were 61.9% and solid tumor was 92.5. And when considering the doses of the drugs, Pembro mean dose was 187 plus minus 33.4 milligram, and average treatment cycles were 10.9 plus minus 4.6 cycle. And for Nivo, the mean dose is 105 plus minus 75 milligram, and the average treatment cycles was 11.4 plus minus 8.5 cycle. When considering the baseline demographic characteristics of the whole study, according to the age, sex, and cancer type, the total population and Nivo and Pembro arms showed the similar type of characteristics. As overall age of the total population is 56, and in the Pembro arm it is around 57, and in the Nivo arm it is 55. When considering the sex distribution, male in the total population is around 62%, and in the Pembro arm 63%, and the Nivo arm 60%. And in the cancer type also, solid cancer in the total population is 92%, and in the Pembro arm 93%, and in the Nivo arm 91%. Now, considering the overall response, 51.25% achieved partial response, representing a significant tumor reduction, and 38.75% achieved stable disease with no significant change, and 6.88% achieved complete response with total tumor regression, and 3.12% experienced progressive disease. Considering the overall response rate, that is 58.13%, and overall survival of 81.2%, clinical benefit rate is including the stable disease 96.88%, mean response duration was 10.5 plus minus 9.2 months. Considering the Nivo and Pembro comparison in each category of the response, they show similar type of response. When predicting factor of treatment success has been predicted, the predicted model showed the response should be around 91.7% and survival prediction is 75%. And age is the most important factor considering the selection of the drug we should use. So we should choose wisely while treating this type of patient with immunotherapy. In lung cancer, we have seen that around 21.62% patient achieved complete response. That is quite high considering the cohort we have. That is 3.1 times higher than the original cohort. That is 6.88%. So in addition to partial response, the disease control rate is 70.27%. And as I mentioned, disease control rate exceeds 58%. And including the disease control rate with the stable disease, 96.88%, that is quite high of disease control and cell stabilization. When considering the stable disease, 62 patients have stable disease, and most of the laryngeal cancer, prostate cancer, non-Hodgkin's lymphoma has stable disease, and around 50% of the RCC and melanoma has stable disease. Considering the breast cancer, we have around 10% complete response in the breast cancer, 45% have partial response, 40% have stable disease, and another 5% have progressive disease. So around 95% patient has some clinical benefit from this study. Though it is not wise to compare the international trial to my small retrospective study, I have tried to compare this thing. When considering the breast cancer immunotherapy real-world keynote trials, Pembro shows a higher ORR, that is 68.8, and DCR 95% in our cohort, comparable to PD-L1 keynote 522 and 355 results. Nivo response was limited because maybe due to small sample size and PD-L1 heterogeneity, and early OS 93.8% aligns with the 3-year OS in the keynote 522. In the lung cancer also, when considering the comparison between the keynote trials, real-world ORR and DCR are higher in the keynote trials. Comparing the keynote trials, early survival 83 to 92 is encouraging. Result may reflect selection bias and short follow-up. So takeaway point is, it is the first real-world evidence from Bangladesh, biosimilar perform as well as the originator. Age is a critical predictor and high efficacy comparable to high-income countries. And deep and durable response, like 58% of, more than 58% of response, and mean response duration 10.5% is quite high. And broader adaptation in the lower and middle income countries like ours may be possible, and there is no difference between the Pembro and Nivo arm. And these are the limitations of my studies. Thank you.
Thank you so much, Dr. S.M. Ariful Islam, for your excellent presentation. Our next